My name is Andy Pace, and my company is GDC Building for Health. You know, I got to say, first off, I've been following this conference for years. And I remember several years ago having a discussion, I think, with Stephen about this. And I always thought that one day maybe I'd be asked to make a presentation here. And here I am, and I couldn't be happier. I'd like to thank Stephen, the entire staff at Real Truth About Health. It's just a fantastic conference. It's an amazing feat to get all of these experts together, and of course, to have all of you watching and listening and participating. It's just absolutely phenomenal. So today I'm going to talk about healthy building, green building, and I'm going to bring up my PowerPoint that I put together for you. You know, I typically don't do PowerPoints because I'm working with clients all over the world, and everybody has a little bit different way to look at what a healthy home is. And so let me just hit play here.
Hit play.
Yep, there we go. There we go. All right, thank you. And so I'm going to talk about, is your home making you homesick? Pretty self-explanatory, but we'll talk about the history of not only my business and how I got into it, but the history of where the energy efficiency, green building, healthy building movement kind of started and where it is now. We'll talk about the rise of the word green, which, you know, just a couple of decades ago was just a simple color. We'll discuss the problems within our homes. And then specifically, I want to talk about some things that have really made a huge impact on the way we purchase materials. One is greenwashing, and we'll talk about that in detail. And the other was the way we counteracted greenwashing is creating our own building product rating system called Degree of Green. We will focus on the healthy home trends that are occurring right now, and of course, have solutions for making your home a healthier space. Now, I really want to make this, you know, informative, but I want to leave enough time for questions and answers at the end, because I deal with, in my career, I've dealt with over 30,000 individuals who have chemical sensitivities, allergies, asthma, or just trying to live in a healthier home. And I've learned from every one of them something about the home environment, and I've been able to retain a lot of that information and share it for people. And so I'm really hoping that we can get some good questions at the end. Whoops. All right, so I grew up in a business, a family business that was started back in the 1930s. It's actually a company that is a manufacturer's representative of commercial construction materials. And so I grew up in the 70s and the 80s. And I remember when I was in grade school, sitting around the dinner table, and you would think that most families sitting around a dinner table would talk about things like, you know, what happened today at school and how is this year's sporting activity going? But no, I listened to my mom and dad talking about architects and contractors and job sites. And I have to be honest with you, it thrilled me hearing about this. It's something I've always wanted to do. And so I went through high school, went to college, got out of school, and decided that I was going to work for the family business. This was in 1989. One of the first things that I did in my young career was I started pioneering a new product line of water-based epoxy and water-based polyurethane coatings for industrial building applications, parking structures, airplane hangars, print shops, anywhere they needed really, really tough chemical resistance and abrasion resistance. And I was working on a project in 1992. It was a below-grade parking structure for a job in Milwaukee. And I went down to the job site to sort of watch and assist the contractors who are putting on the coatings and be there to answer any questions they may have. And so I made sure, first of all, that they taped up all of the air vents. They cordoned off all the hallways or walkways so that none of the any of the chemical fumes would actually get out of the space. At least I thought that's what we did. Um, I remember after the primer coat was applied to the entire surface, we started getting phone calls in the job trailer from people who lived in the condominiums above, complaining about the odors from the chemicals that were being used. Now, again, this is 1992, and we thought it's a water-based product. It can't be bad. I mean, look at all the solvent that we don't have to use. We've come to find out that a product that's called water-based, even still to this day, just means that only 50% of the liquid component is water, and the rest of it can be all sorts of solvents that you've never heard of. So we're working on this project. People are complaining about the odors of above, in condos of above. One of the complaints we get is from a sitting United States senator who happens to have his Milwaukee business office there, and obviously complaining about being driven out of his condo. And then what happened, it completely threw us all for a loop and completely changed the direction of our company from here on in. 3 of our own workers were rushed to the hospital because of inhalation complications. They couldn't breathe. They literally had the oxygen sucked out of the room during the curing process of this primer coat, and they couldn't breathe. And we didn't know what was happening at the time. We just thought inhalation complications, let's get them out, ambulance over to the hospital. And that's what it was. They didn't have enough oxygen. And so I was still young in the industry, 3 years in, and I thought I wasn't going to embarrass myself, embarrass my family business, ruin the reputation that we built over the last 60 years, and sell these coatings that were potentially harmful to people. And so I went on a quest around the country, talking with every expert that I knew on how to finish up this project with materials that were healthier. And I found a very, very small company in California called American Formulating and Manufacturing, otherwise known as AFM. And I'll tell you, that just opened up our eyes. AFM was a company that was making paints and coatings and some specialty sealers for people who had these things called multiple chemical sensitivity or environmental illness or sick building syndrome, things I've never heard of before. Now, again, I was only a few years into my career, but I knew enough about construction from living within this in my family that you think I would have heard these terms before. And it was completely new to me. So in 1993, we opened up a store to sell these healthy materials. And at the time, 95% of our customers were people with extreme chemical sensitivities. And about 5% of those customers, or our customers, were what I would call environmentally aware. So why did we get into this mess that we are in now, and the mess that I saw back in 1992? Well, where it really all starts is the oil embargo in 1973. That's the energy crisis in the 70s that drove all building owners, even contractors and architects, to design spaces that utilized less outside energy, to design homes that were more energy efficient. You know, in commercial spaces, they would reduce the amount of fresh air intake just for the sake of reducing the cost of either heating or cooling that fresh air, but to the detriment of anybody living or working inside that building. And so that's where the term sick building syndrome actually came from, was from the fact that these buildings didn't have enough fresh air to counteract everything else that was going on in that space. Also, throughout that time, we had this huge influx of new manufactured plastic building materials, very cheaply made, fast built products and projects. You know, you have to remember from the 70s and the late 70s, early 80s, the interest rates on residential projects were upwards of 20% for a loan. And so the only way that builders could get families into new homes was to cheapen up the cost of actually building the home so they could afford the payment. And so they used a lot of manufactured products, a lot of plastics, a lot of things that were bound together utilizing very inexpensive materials like urea formaldehyde, which we now know is a carcinogen, but at the time and still to this day is found in countless building materials that we encounter on a daily basis. There was also this trend towards energy efficiency, and we'll get to that in a little bit. The trend towards energy efficiency really focused on, again, outdoor environment, saving energy costs, but really forgot about the human occupant. I would call this the unintended consequence of trying to do the right thing. I believe that, again, in the late 70s, when it was, I don't know if anybody remembers the government made up this story about how we're running out of landfill space. And it was completely made up. It was actually just designed to sort of get the country to come together in the malaise of this recession that we're in and get everybody to sort of move towards a better goal. So they made up a story about we're running out of landfill space. And that's really what started the entire green movement at that point. Reduce, reuse, recycle. You know, I just had a conversation today, as a matter of fact, with a builder who got his start in the early 70s. And he brings up to me in the conversation, boy, I remember that 1973 oil embargo. And that's what completely changed the way we looked at buildings. And he was exactly right. So one of the things that I deal with on a daily basis is working with people who have extreme chemical sensitivity. And I want to spend some time talking about chemical sensitivity because it really is the crux of what we do and how we help people moving forward. With chemical sensitivity, first off, you have to find out how did somebody become chemically sensitive. And these are really the ways that it happens. Massive exposure to some natural or unnatural substance, life-altering medical event, low-level exposure over a long period of time, or another underlying medical condition. And I'll dig into that in a bit. So massive exposure to an event. 1976, the American Legion's having their annual conference in Philadelphia, and several hundred people get these really crazy flu-like symptoms from an unknown source. Out of that, over 30 people ended up dying. And that's when we found out about Legionnaire's disease, or Legionella, a bacterial infection or bacterial poison that was gotten into people through drinking water and in the HVAC systems. So that would be a massive exposure. Somebody would walk through a building that just had the corners of the room sprayed with pesticides for ants or roaches, could actually trigger a chemical sensitivity. Mold exposure, we'll talk about that in a bit. One thing I always like to bring up when we talk about massive exposure to chemicals is a very embarrassing situation that happened with the EPA themselves in their own building in downtown DC. In 1987, they were doing some remodeling in the building, and they had about 27,000 square feet of carpet replaced during this remodeling project. Now, keep in mind, there was about 700 people working in the space at the time. After this carpet was installed, they had about a quarter of the workforce actually went home sick because of exposure to this, what they would call toxic carpet. And they eventually figured out what the ingredient was in the carpet, and they were able to rip it out and replace it. But to this day, there are still almost 24 people on permanent disability because of that event. Life-altering medical events, childbirth, major surgery, a car accident, something that will change the body chemistry and the body electricity. That can actually cause chemical sensitivity. And then an underlying medical condition. This is probably, I would say, the most research that's being done on chemical sensitivity is actually because of research being done on underlying medical conditions. Most specifically, Lyme's disease, chronic inflammation response, and mast cell activation syndrome.